In the Health Talk series, our guest today is Dr. Vijay Yagnick. He is Director and Head of Crohn's disease at Mass General Hospital. And today we are going to talk to him about that and everything else related with that. Also, he will be a speaker at our upcoming Health Expo 2016 at the Burlington Marriott, and where he will talk in much more in depth about these issues. But right now, Dr. Yagnick, thank you very much for coming to our studio.
Thank you, Mr. Mishra. Thank you for having me today.
And your time. So I'm going to have a hard time pronouncing that name, okay? But I'm just going to, for simplicity purposes, I'm going to call it Crohn's disease.
Correct.
So let's talk about that. Number one, what is that? And second thing also I want to ask you is, what is the difference between intestine inflammation and infection?
Yeah, it's a very difficult question. In fact, even my mother still doesn't realize what I do.
Okay.
She keeps asking exactly what do you do, and she says to me in Hindi that I never am good in explaining what I do. So I've already been.
Okay.
So intestine, as you know, is a very complex organ. Some of the simple things that the most number of immune cells in your body are always trafficking in the intestine. The one way to think of it, our immune system goes to school in the gut because the gut environment, the intestinal environment, is dramatic. Whatever we eat, not eat or choose to eat, fast, everything happens in the intestinal environment. Mm-hmm. And human history is that we have had significant issues with infections. So people that have survived are very good in fighting infections because, as you could see in the last several hundred years, that we have almost doubled our lifespan, and that has happened because of we understood what infections were and we were able to overcome them. Then comes another complex problem where the disease is behaving as if it's an infection, but it doesn't go away. So even when you go back and think of diseases in India, infection happens, whether you take antibiotic or you don't take antibiotic, it typically resolves in 2 weeks. Mm-hmm. We call this a self-limiting disease. But Crohn's disease and ulcerative colitis are two diseases where the inflammation does not go away. And it's very similar to what happens in the brain in multiple sclerosis or on the skin in psoriasis. They're almost similar things, except the organ of damage is different.
And how common, this disease is, in terms of, if you go also in geographical areas, right. US, India?
Yeah, that's a very good question. And so just historically speaking, these diseases were described in Europe and America in the late 1800s. So ulcerative colitis was described as this blood coming out from the stool, a very dramatic disease. And then 40 years later, another disease called Crohn's disease, which I will go into more details, came up. And so in India, they were first described in 1960s, so about almost 50 to 60 years later than what we saw in European communities. Mm. So when I had gone to medical school, or my father was in medical school, these were thought to be diseases affecting predominantly Jewish community and not affecting any one of us. But it's all incorrect now. Over the course of time, as our environment has changed, it happens everywhere. So you could happen to an Indian person that's never left the country or never have left even their own village. Ulcerative colitis was described in Delhi in the 1960s, and now there is much more Crohn's disease 40 years later. Crohn's is more common in South India than North India, but so typically.
So what is the reason for that? Why is it's a food or spicy?
So part of it. So we don't know. So in the year 2000, we had no idea what was causing this disease. So this was a big medical puzzle. And then thanks to the investigators that did human genetics, today we know there are about 200 genes or 200 different basically polymorphisms or changes in our DNA that basically contribute to the disease. So unlike certain diseases where one gene defect causes a disease, this is more like diabetes where many genes are altered, and it's basically the perfect storm. So it's your genetic makeup and your environment, and some trigger happens, and it's thought to be the microbiome or the bacterial community in our gut seems to be our central focus of our health. Whether we are healthy, the microbiome has to be healthy. If we are diseased, then the microbiome is diseased. So both have to get better to live a healthy life.
Now, since you mentioned earlier that blood coming out in the stool. And I don't know what exactly the term for that, but in India, when I was growing up, we used to hear this disease they used to call bawasir or something like that. Is the same thing?
Bawasir is essentially, I think, an Arabic or a sort of Persian word for hemorrhoids.
Yeah, okay.
So that basically is a vein at the end of the anal canal that if you have too much constipation or you go too much, can puncture and cause blood. That's one of the most common causes of bleeding. Intestinal discomfort predominantly happens through what we call neurological symptoms or functional symptoms, where the patient is suffering either they're not going to the bathroom, what we call constipation dependent, or diarrhea where they go 3 to 4 or 5 times a day. And it's not that when we go do a colonoscopy, everything looks perfectly normal, but the patient is very uncomfortable. So these are called functional disorders, and you may have heard of it, they're called irritable bowel syndrome. And so a lot of people confuse Crohn's and colitis with irritable. So our disease, Crohn's and colitis, is inflammatory bowel disease because there's inflammation. And this inflammation is visible. So if you go out in the sun, you get a sunburn, it's a visible thing. It's pink, it's a little swollen, it's tender, there's some pain over there. Same thing happens in the intestines. If you do a colonoscopy, the lining looks visibly damaged. So it's something that's very obvious.
So, but colonoscopy was another question on my list here. And many of us are very scared,
Yes, I would be.
That's I don't want to do. Many people keep postponing it.
Yes.
So how necessary it is to do colonoscopy?
I think one of the struggles is, as an Indian community, we don't really understand what is a risk of colon cancer compared to sort of the Western community where it's much more defined. And I think very early on now studies are coming from India. See, in India, typically nobody gets a colonoscopy. There's no culture to get a colonoscopy unless you have symptoms. So we do procedures essentially for 2 reasons. One is we call screening a population. So if you, let's say, if I give you an example in Japan, gastric cancer is very common in Japan. So we do another procedure we call upper endoscopy. We put the camera in the patient's stomach to, typically to look at ulcers and cancer. So in Japan, you can go into somebody's house at 4 o'clock in the morning, knock on their door because they have an empty stomach because they haven't, eaten breakfast, and then you can do the procedure in their home. So that's called screening population. So here, after age 50, everybody's supposed to get a colonoscopy because we can very economically remove so think of getting a mammogram. Same thing, you can remove a polyp that's a precancerous lesion to colon cancer. And this was very important because 5-10 years ago, colon cancer, it was a significantly lethal disease because if the colon cancer spreads, the treatments are not as good. So the best way to prevent colon cancer is doing surveillance. So somebody gets a colonoscopy every 5 to 10 years based on guidelines, you may never get the disease again. And so it has really contributed to longevity of this.
But we also hear that, the colon cancer is more common in Caucasian population than as compared with Indian or South Asian.
That is,
and that's why it may not be as necessary to do colonoscopy.
That's correct. But the problem is we don't really know our numbers, and we really don't know because there is so much underreporting. And I think now, as Indian medicine is advancing, Indian epidemiologists are getting better and better at this, and this question is being addressed now. So typically the second type of colonoscopy we call diagnostic colonoscopy. That happens because you lost weight, you had diarrhea, or you had blood in your stool. Then you need to do it because you're having something you think. So the colon cancer screening is the person is completely healthy, they have no symptoms, there's nothing going on. They're getting as if they were going to go for a mammogram. Second one is if you have a symptom like blood in the stool, then you are absolutely necessary to get it. So in India, typically most people get it because of a diagnostic colonoscopy, which is for a diagnosis.
Okay. Now let's talk a little bit about the infection in intestine.
Yes.
And what type of infections they can be.
In most common infections in United States, intestinal infections are literally very rare. They happen if you go to, let's say, a restaurant or something, and you've heard that they got a community acquired bacteria in the salad or something like that. So typically, one of the most common here is called Campylobacter. The Campylobacter can cause diarrhea with some bleeding. It typically comes from eating chicken. You've heard another major restaurant chain recently had this problem where a lot of students got diarrhea and they had to shut down. That's typically salmonella type diarrhea. Another common one here see this is where you get a lot of bloody stool is E. coli type diarrhea, which just comes from meat that's undercooked. So if you get an undercooked hamburger, you can get it. In India, we get all these things, plus we also get a lot of parasite diarrhea, like amoeba is the most common cause of diarrhea there, which is a lot of blood and mucus. So typically when patients come to see me here, we're not that concerned about infection because our food is so clean and hygienic that we don't see it.
It's also cooked too, right?
It's but people eat salad and it's raw, but still it's so it starts from the cattle industry, the plants. Everybody is so monitored that we don't see these infections. Best way to think of an infection is that the sewage, the stool, the contaminates the drinking water. That's when we start seeing the infection. And the best example of that is a disease called hepatitis A. In India, everybody gets hepatitis A by age 6, 7, 8, 9, 10. You cannot get out of age 10 and not get hepatitis A because it's the feces that contaminate our water. Here, the water and sewage are very, very separate. So most American people have never got hepatitis A. So if they go to India, the first thing they're worried about, they'll definitely get hepatitis A. So that's the.
So they have to take some vaccines or something.
You can take a vaccine. Or you could. Sometimes we use immune globulin, depending on the seriousness of the situation.
So what about the water? Like what type of things we can have from water?
So water contamination. So if water has any sewage contamination, I know people listening will think that this is disgusting, but it's truly that's how it's driven. Most of the water that, at least in the Northeast, the water is very, very pure and clean. The contamination comes from the houses that people have, whether in the local pipes. It's not coming from the main because they come from beautiful spring water in upstate New York and Massachusetts. In New England, this is terrific water. We don't have many issues. But with waterborne is, if you go to lakes, so for example, you came from India and you were very interested in swimming in lakes in New England. So there is a parasite called Giardia that people get here that gets a significant abdominal discomfort and diarrhea that we see. So typically what your physician should do is, if they are suspecting it, you have to do a stool test. And here the method is very simple. They give you like a hat that you can put it on the toilet bowl and you can poop in it and then pour it in a cup and send it to the lab. And the lab will test for either ova or parasites if they think of a parasitic diarrhea, or they will think of there are 5 or 6 big top bacteria that they will look for depending on what the question is.
Now I have one personal story and I wanted to see your. I spent about 9 years in Mexico.
Yeah.
And when I went there for the first time, I had been there only for about a month. And then a friend from Brazil was also visiting.
Yes.
And she told me a story that they drank water in Mexico.
Yeah.
And then their intestine got infected. And the doctors had to cut 3 inches or something like that of their intestine because it was so badly infected. And it had such a dramatic impact on me. I never drank water in Mexico City. I drank the bottled mineral water. Or really bought water boiled, for half an hour or so.
Yeah.
Is there any truth to that? Or?
Well, it's so. As I told you, the infections of the gut are typically self-limiting, except when it happens to 2 types of situations. So let's say you have a very young child and they get diarrhea, and they got what we call small bowel diarrhea. So the best example in the world is cholera. So cholera, Indian kids cannot survive in the villages. The kids get cholera and they die because of severe dehydration. Same thing can happen to our parents who are elderly, who cannot actually get up and go to the bathroom or go to the faucet and drink the water. So very young and very old are very susceptible to this type of sort of massive diarrhea. And the best example in the world is cholera. Cholera vaccine is just a big thing. So if you know that, we call Gatorade such a big thing, but all over the world people drink this WHO made powder that you put in the water. But in America everybody drinks Gatorade because that's the big sort of financial sort of driver of athletes and sort of sports activities. But the diarrhea that you get from those types are very dramatic and you don't even need surgery. What you're describing is a surgery, and chances are this is more like the disease I'm telling you about, is Crohn's disease.
Sure. Okay.
Or it could have been that the patient developed either intestinal tuberculosis or something that developed an abscess. That means the wall of the intestine we take our intestines lightly, but just to give you some examples between sort of cardiology and gastro. So if there's a puncture wound in the wall of the intestine, every bit of bacteria will leak out and we will die within minutes.
Mm-hmm.
So that type of damage is very serious, and that's when you go for an operation where they remove an internal segment. Same thing if your appendix is hot and it gets very inflamed. If you don't go to the hospital, you can puncture and you can actually die. So we take appendicitis very lightly, but
Mhm.
that's sort of the same idea.
So, is there anything we can do, something to make sure that our intestine is clean, or there is no way to know anything?
Well, it is, so now what have we learned now? So the new thing, and I'd like to focus a little bit this in the Health Expo is what we've learned is, very interesting is that there are 4 major communities of bacteria in our body.
Mhm.
So if you ask somebody, well, how many, do you have 1,000 bacteria in your colon, different families, or, so if you do the genetic methods of DNA sequencing can actually really organize all these families. And we think there are 4 families. It's 2 very good families and 2 not so very good families. So it's like Mahabharata has a story of 2,
Right.
one good family, one not so good family. This is Mahabharata times 2.
Sure.
So you
Okay.
can imagine how complex it is.
Okay,
Mahabharata
sure.
is
Good
so
way
hard
to say,
to-
yeah, sure.
So I call microbiome Mahabharata times 2.
Mm.
And Mahabharata times 2 means that it has so much different community. So we don't know what happens to our microbiome. So let's say I was born in Lucknow, then I lived in Delhi, then I've lived in New York City, and I've lived in Boston.
Mm.
So each town must have left an imprint in my system,
Sure.
right? So as we said, this whole idea that I went to Mexico and I got an infection, I will get a patient of, ulcerative colitis who's convinced that, we went to our honeymoon in Mexico and 2 weeks later I got blood in my stool. Possible that the trip to Mexico may have contributed, but ulcerative colitis is not an infection.
Mhm.
And when it's not an infection, that's where we come in with our complex drugs, where we bring in, very simple aspirin-like drugs to very complex monoclonal antibodies that actually reprogram your immune system to make you healthy.
Mhm.
So these diseases are hard to understand because there is a symbiotic relationship between our body, our immune system, and the microbiome in the.
So if there is any symptom, like anything wrong with my intestine,
Yeah.
what are the symptoms I should look for, and if that happens, I should
So
consult?
I think nobody, if you look and, I have always said this, that typically people don't like to talk about toilet habits at home.
Mm,
It's very
mm,
common.
sure,
You try
sure.
to avoid it.
Actually, I was going to ask you a question when you
Sorry.
said that that you put those things in the hat, and
Yeah.
so I was just thinking about the guys who go and do the testing and all this stuff every day.
Yeah, yeah.
How
I mean, but you
How-
have to take the yuck factor out because,
Mm.
so let's say, imagine the guy who cleans the sewage and this and that. In life, their jobs are difficult, but their contribution to society is huge. I mean, people who work in the labs have to deal with,
Yeah, sure,
all
yeah.
kinds of secretions.
Sure.
And when you start as a medical student, if you see it the first time, it's pretty shocking
Mm.
what
Mm.
type of things happen.
Mm.
But to go back to the question, what you should look for.
Mm.
Now, my typical thing is that whatever your natural physiology is, so let's say if I'm a person that wakes every morning at 6:15, then I have my cup of tea, and I go to the bathroom, that's me, and I know it.
Mm.
And if I don't do that and something happens, I know something is wrong. So
Mhm.
it happens for the first few days, you say, well, maybe you'll get better. And majority of the times, if there's any fluctuation, it usually gets better in a few days. But when it's persistent, consistent, obviously that's the time you should seek help. So if you're going a lot or not going at all,
Mhm.
or you're having abdominal pain, you're having weight loss, if you're having blood in your stool, if you're having significant distension or nausea or vomiting, we use a word called alarm symptoms.
Mhm. Mhm.
Nobody has you wake up in the morning, I had puris last night, so I know I'm not going to do great today. So you kind of know what you did.
Sure.
Everybody has a whole thing, but my sort of perception of this is that you have to understand an alarm symptoms, and blood is most significant one in there, or mucus of something that that like it looks like pus or white mucus or may come from your sinus.
Mhm.
That if that's coming from your in your stool is a problem.
Mhm. Is there any particular age where these will
So
become
we
more?
always say that these type of diseases nobody is born with.
Hmm.
So right, when you're born. So that's an interesting point. Is when you're born, and the intestine is completely sterile. It has
Mm.
no bacteria.
Mm.
And how you populate that, this whole thing about, this whole idea of how to develop a healthy microbiome, a lot of people are focused right at childbirth. So it's very kind of important to go through these steps of understanding. So Crohn's and ulcerative colitis, the sicker patient develop around age 10.
Mm.
And age 10 to 30 is the main peak.
Mm.
And then the disease kind of cools off. And then later again in life, 60s, 70s, 80s, you can have it again.
Mm.
So the person who's 65 years old, first time is diagnosed with ulcerative colitis, they completely get puzzled. They call me and they say, what happened? I had the best intestine all my life. So that's why it is such a big puzzle, that what it takes to break down the relationship between your immune system and the microbiome of the gut is a complex problem. And I think it's a challenge for all of us down the road to really come up with really intelligent saying, you cannot do this in a mouse. We have to study our own community. That's the only way to
So
get it done.
now, I'm just going slightly after track
course,
here, is like I was asking earlier about the water. So say I was born in India, grew up there, and then left India, 30 years ago or so.
Mm.
So now when I go back to India,
Mm.
and I'm told that I should not drink the water there the way I used to drink before when I was growing up there.
Mhm.
So is that changes
Yeah,
happen?
so
or-
there is the most common, there is a word called turista. Turista is a diarrhea that tourists get because when they drink the water, again, is that fecal contamination I told you about originally in the sewage. That contamination has a little bit of E. coli that causes a distress.
Mm.
It can be very serious or could be milder. So people locally get more used to the community and the environment. And today in the United States, there is a new disease over the last 20, 25 years. So let's say, in India, we use antibiotics without any regulation. I can go to the pharmacist and say, I need medicine. They give it to you. You don't need a prescription.
Sure.
So one thing we have seen here is if I gave somebody an antibiotic, that gut community structure that I've been telling you, the population gets disrupted because the antibiotics wipes out a lot of good things. And then within weeks, then you get a diarrhea. It's called C. difficile colitis or Clostridium difficile colitis. And that is a very dramatic disease. It happens because we took an antibiotic. So that's the best example of how antibiotics can actually negatively affect our health.
Mm.
If you don't take it, you don't get it.
Sure. Now, let's come back to a certain type
Yeah.
of food too. And so my first question is, and especially very relevant to the Indian and South Asian population, is the spices. Some people eat very spicy food,
Yeah.
some people don't eat.
Yeah.
Has it anything in impact?
No, so I think people think that, even the Western, one of my American patients will sound like, if I eat spicy food, will I create a hole in my stomach? That's
Yeah.
the kind of thing that they
Right,
have this
yeah, sure,
imagination
yeah.
that this piece of spice is going to burn. So typically that's not the issue. Most people feel spicy food in the hemorrhoidal area because that causes a little irritation. The intestinal nerve system is very different than any nervous system that we can think of.
Mm.
We don't have in our intestines. So even if you were awake, I did a biopsy in your intestine, you will not feel it.
Mm.
If I did a biopsy on the skin, you'll punch me because it hurts so much. So the nerves of the intestines are very different than the nerves outside. So the intestine is designed to accommodate a lot of environmental change, and spice is part of it. So I don't think spice causes anything negative per se.
Okay. What about like mircha, like if you chili?
Same idea, but I remember first time I ate Mexican food and I ate jalapeno, I felt it next day in the bathroom, but it doesn't mean it's hurting. It's not, necessarily.
Okay. And what about vegetarian versus non-vegetarian food?
So we thought that there was initial studies particularly for Crohn's disease, but you can see a pure South Indian Brahmin with no kind of any animal product in there can still get the disease.
Mm.
So inflammation is not regulated, but one good study that we know that if you introduce the tonic for the gut lining, so the epithelium is the lining of the intestine, the tonic is basically these 3-chain carbon gases like methane and butane. These gases are made in the intestine when we eat fiber, and the bacteria and the fiber meet. They make the healthy stuff. So that's one good molecular analysis of how dietary fiber, which is so important to our health, we need to eat it. So that's why people who predominantly eat meat miss out on the fiber, and so the soluble fiber and the vegetables are extremely important.
Next. What about anything, drinks like?
Typically, as you know, drinks can, the biggest effect of alcohol is either in the pancreas or in the liver. So cirrhosis of the liver happens because of drinking, and also this pancreatic, you can get chronic pancreatitis from alcohol. But typically, some people can get, stomach inflammation. We call gastritis, and particularly they can definitely get bothered by it. But and then there's the next thing is this food allergy business. People are saying, well, what am I allergic to? Food allergy is even more complex because we don't know how to test for it, because it's not like I can, when you do a skin testing, well, that's not exactly what's happening because it's a different, right? So it's like doing an experiment in a completely different local area. But we do know that people are allergic. You can, some people develop allergies to, say, banana, and even apples people get allergic to, but when they're cooked, you can eat them. So sometimes, so we think for food allergy, at least if you can, as an adult, decide, if I ate this particular type of food, if it bothers me, you should just avoid it.
Now, one personal question for you is, I have a lot of friends who are doctors and all, but I've never met anyone who specializes in what you are doing.
Yeah.
So how many specialists in your area are like you today?
Yeah, so this is in a relatively new area in gastroenterology.
I mean, how old is this area?
No, the area is old. The problem was that this disease was predominantly treated by surgery, because people used to have surgery and then they used to wear a bag, and there was this ulcerative colitis means go to the hospital, remove the colon, and put a bag where the small intestine comes out and sits in a bag. And it's devastating, and because if you get it, nobody wants to talk about it. You just don't know, because if you've never met anybody that has had a bag, it takes time. So and imagine the person who's going through these situations. But in the last 10 to 15 years, we've made magical improvements in the treatments.
Like what percentage if you go from?
So today I can have a 15-year-old kid that gets diagnosed with Crohn's disease, and if it's given the right treatment, they never miss school. They can do anything they want in their life. It's just not limiting at all. And it happens in our community. The Indian community gets hit pretty big time with this disease. So I think what we think is we have about 1.2 million people in the country with this disease.
And how many doctors are like you who are specializing?
Not that many. And so we have a new advanced training up. So you have to finish medicine, internal medicine, and then you finish gastroenterology, and then train for one more year in this Crohn's disease area. So it's a much needed specialty. If people who are interested in medicine should consider it, there are very good job options after.
This one,
Yeah.
yes. So again, you didn't answer my question.
Yeah.
So how many physicians are like you in the United States who specialize into this?
So
Don't be modest.
they're not that. I mean, I don't know the specific number, but there are only a handful of good physicians in this area in Boston. But if there are other parts of the country, they don't have. So so we are lucky that we're in Boston. We have some top physicians, but I would say probably there are 200 good physicians in this area in the country.
Excellent, good. Dr. Allergy, thank you very much. Really, and now we have made it very exciting to come to the Health Expo.
Thank you so much.